Good morning. Can you see the frog? At least it knows what to do when it is tired and stressed. Just lay back and rest. But we humans, no. We have to go from acute stress to chronic adrenal fatigue, and then you go into burnout syndrome. So the topic today, the first topic is on adrenal fatigue. So we'll talk a little bit about adrenal insufficiency. Then we'll talk a little bit about adrenal fatigue and some solutions. Most of the time, this adrenal fatigue is in people who don't seem to understand that if you keep prolonging the chronic stress without breaks in between, that leads to problems. But you don't actually realize. Most of us keep pushing ourselves until we get so tired and fatigued, and yet we do not connect the dots. Many of us have no idea about adrenal insufficiency or adrenal fatigue. And the reason is because we are also not well exposed to the options available. If you want to treat adrenal insufficiency or adrenal fatigue, then you have to look at the whole spectrum. It has to be a change in diet, it has to be a change in lifestyle, it has to be nutrients, and the cornerstone will be hormone replacement. So when we talk about hormones, it's always natural or bioidentical hormone replacement therapy, BIHRT. It is very different from synthetic hormones. We have never been exposed to natural hormones. The simple reason is because, as you heard yesterday, any natural products cannot be patented. So pharmaceutical companies have no interest in something that they cannot patent. So you will not hear about hydrocortisone, but you would have learned about prednisolone. Am I right? So prednisolone has so many side effects, whereas hydrocortisone is almost nil. So what we are going to talk about is natural hormones. Now, if you do not manage stress well, you will have prolonged stress, and acute stress becomes chronic stress leads to adrenal fatigue. So it is the most prevalent yet grossly underdiagnosed condition, and if you want to manage it, then you will have to look at the underlying causes, and which we'll see. Now, if you identify chronic stress, and if you take the remedial actions, then it is reversible. Someone asked me how long does it take to reverse adrenal insufficiency? It could take months, probably up to 6 months. But if you push somebody to or yourself to adrenal fatigue, it could take years. But the most important thing is in acute adrenal fatigue, if you want to recover, you should at all possible costs, you should avoid a crisis of acute stress. Let it be infections, emotional, psychological stress, you must avoid. Then otherwise, you'll sink again. And to lift it up will be difficult. This is one reason why patients with chronic fatigue find it very difficult to recover themselves. Because the diet is not what we should be eating. Now, adrenal hormones, most of you all know. You have from the adrenal cortex, most important would be cortisol and DHA, but you have estrogens, aldosterone, progesterone, testosterone, and pregnenolone. These hormones become very important, especially when a woman reaches menopause or a man reaches andropause, because they become the reserve sources of hormones, as well as your ovaries. That is why women, when they have hysterectomy, should not remove their ovaries, because they are the source of hormones, especially testosterone, in menopausal women. So there are many hormones, but we will be talking about DHA and cortisol. Maybe I can mention a little bit about aldosterone. All these hormones are available from companies that sell supplements, as well as compounding pharmacies. And compounded hormones are also registered because the companies themselves have license. So you can use them freely. And then you have, from the adrenal medulla, you have epinephrine and norepinephrine, adrenaline and noradrenaline. So when there is adrenal insufficiency, Can you all stop recording, please? Any one of you all who are recording? Yeah, no? Okay. So when you have adrenal insufficiency, you have an effect on all these hormones as well. But the most prominent ones will be cortisol deficiency. DHA doesn't present itself in very clinically, not in acute stage. So adrenals are the glands of hope because the hormones that you get from adrenal glands are responsible for energy, your endurance, your mood, your response to stress. How many of you all feel tired when you wake up? No? Everybody is energetic? Oh, that's very good. Actually, I think it is true because most of you are here very early today. So all of you all are full of energy. Now, what happens if you get a patient who complains to you feeling very tired in the morning? What are the hormones? Anybody? When you wake up feeling very tired and you need to get your engine warmed up before you have the energy, then it's thyroid. Thyroid is very simple hormone. You can make a clinical diagnosis if you only have the habit of shaking hands with your patients. Okay? Because they'll be cold. Trust me, a lot of children are also hypothyroid. And it plays a huge role, especially in what I do as an obstetrician. Because it ensures a healthier pregnancy and a healthier baby. Or it makes a lot of difference, world of difference in those who practice obstetrics. Anyway, so if you have thyroid hormone deficiency, you are very tired, especially in the morning, but you feel better afterwards. If you have cortisol deficiency, you are tired and you are also hungry and angry. And you will have another crisis of energy towards the late afternoon. That is typical of cortisol deficiency. So remember, when you replace especially cortisol, you will have to have a morning dose and an afternoon dose. Otherwise, you will crash again by 2 to 3 p.m. Okay? Now, if you have an energy crisis throughout the day, then it is likely to be growth hormone deficiency. If you feel tired, especially after exercise, and if you have poor recovery, then it is very likely to be testosterone deficiency. All these are hormones that play a very important role in health and longevity. So adrenal hormones, they have a lot of effects in the body. So they have physical effects in terms of energy that I mentioned as an example. They have physiological effects because some of these hormones control your blood sugar. Some of these hormones, they have very strong effects on your immune system. And they also have emotional effects, especially cortisol and DHEA. Cortisol gives you a sense of calmness. You are very relaxed even in a situation where there is a lot of stress. So you are calm, you are energetic, you handle stress better. Otherwise, you are irritable, moody, and angry. DHA always gives you a sense of well-being. So it has got multiple effects in the body. So most of my treatment will always involve changing diet, which you'll hear more in the next lecture, giving them all the nutrients that their patients are deficient or insufficient. Most of us are. Don't think that your vegetables, your fruits, and the food that you eat is going to give you most of the vitamins and minerals that you require. You will be deficient or you'll be insufficient. You will never have optimum health without optimizing these nutrients. So supplementation becomes very important. So the hormones, and then the next one I do is to check the hormones and correct the hormone deficiencies. Most of you all will know that you cannot look at the reference range. I think most of you all are new. How many of you all are sure about these reference ranges? Because you do blood test, you get a range, isn't it? Right? So when we talk about more detail about just one hormone, maybe I can give you more in detail, but for now, just understand this, because you understand this, only then you can put it to practice. Now, say, for example, you test free T4, okay? The lab that I use, that's Gribbles, so the reference range is from 9 to 25. So somebody at 9 is normal, somebody at 25 is normal. 8.9 is low, 25.1 is high. Do you think it makes a lot of sense? Which means everybody between 9 to 25 is supposed to be normal. Okay? But majority have cold hands and cold feet. We don't tolerate cold very well. Am I right? Many of your patients. So this is clinical hypothyroidism. Why is it not picked up? Because you are looking at reference range. Reference range is very wide. So clinically it is not applicable. Why it is not applicable is also because this is not taken from healthy people. So the labs, what they do is they collect, say, 10,000 samples and they just average it out. And that's why you get reference range. It does not reflect health. So in order to understand what the patient needs, and that is very well correlated clinically, is to understand that optimizing your nutrients and optimizing hormones is very important for health. That means the optimum level should be the 25th centile, which means you should take about 75 to 80% of the upper limit, that is of 25, which means around 20, 21. Only this is optimum. So if you have a free T4 of 15, although it's normal within the reference range, the patient is still hypothyroid. You can get hold of the book by Thierry Hertog, the Hormone Handbook. All the references are there. And clinically, when you start doing this, you know it makes a lot of sense. Otherwise, you label 95 of your patients as having euthyroid function, normal thyroid function, only leaving 2.5% below and 2.5% above. But it's not, you don't see this in clinical practice. 95% could be hypothyroid. So you have to understand the reference range. Always have the optimum, which is the 25th centile, 75 to 80%. But there are exceptions. You cannot use this rule for insulin. You cannot use this rule for estrogen. Okay? So these hormones have effects on the metabolism of fats and carbs. The rest of it you heard yesterday, TCA cycle. They have an effect on blood sugar, especially cortisol. Cortisol deficiency will lead to hypoglycemia and episodes of syncopes. They have an effect on regulating blood pressure. Cortisol has an effect on blood pressure, and so is aldosterone. Okay, aldosterone is a hormone that retains salt and water in your body. Any other hormone that retains water in your body besides aldosterone? Anybody? Any other hormone? Vasopressin, that is secreted by your posterior pituitary. It has an effect on fluid and electrolyte balance, especially sodium, and it becomes the major source of sex hormones in postmenopausal women that I've mentioned. So you have to look after your adrenals. So the problem is moving from stone age to stoned age, because stress used to be episodic and short-lasting. That was the days. Those days is gone, even for your children. But now we have this is called the stoned age. So you just lost, like people who have stoned themselves with drugs. You are just lost, don't know what to do. So all the time, including, actually I should have put a picture of children as well. Have you seen children nowadays? They're always like this. So they wake up very early. We are actually doing a lot of harm to our children, thinking that we are doing good. So you wake them up by 5 o'clock in the morning and ask them to get ready, stuff breakfast into their mouth, ask them to eat quickly and swallow with water. And then we put them in the car, send them to the school. Then we pick them up from the school, send them to the tuition. And they eat in the car. The family never sits and eats together. And one tuition to another tuition, including Sundays, public holidays, and worse still during school holidays. And then they go for their music class or their karate class, whatever. And they, what are you doing to your children? It's very important to realize that children can be in adrenal insufficiency or adrenal fatigue. Very easy to recognize. These children will be frequently sick. And they are very defiant. They are very defiant. They are frequently sick. If children are frequently sick, thyroid deficiency, cortisol deficiency. I usually don't correct cortisol deficiency in the children because I just teach the parents what to do. Change their diet, give them rest. Usually the body recovers. Okay? So don't go into the stoned age. You can always prevent it. Now, chronic stress means it's the persistent high levels of stress because you don't know how to take a break. It's very simple. When you are under a stressful situation or your work is long, you have to work long hours, just after every 2-3 hours when you feel that, you're not thinking right, just stop everything. Close your eyes and take 5 to 10 deep breaths. How difficult it is, takes 1 minute, but you reduce the stress. So this is a problem of having prolonged stress. And then what happens if you do not sort it out? There are various adaptations in your organs. So that is where you get into trouble. For example, your immune system. And then it definitely has long-term ill effects. Adrenal insufficiency can start in utero. Pregnant ladies nowadays are also under a lot of stress. And when they deliver, these babies are born with hypertrophic adrenal glands, trying to compensate for the stress. And these are the children, newborn babies who could also be constantly sick. Added to that, women do not breastfeed because we believe that the cows do a better job than the mothers. Yeah? Because cow's milk is the best for newborns. It's very sad. Many mothers do not breastfeed, and being an obstetrician, I hear various excuses why they can't breastfeed. The baby doesn't suck, doctor. Or I don't have milk, doctor. I tell them there is no baby born which doesn't know how to suck the mother's nipple because they already start sucking their thumb in utero. So, but anyway, they don't breastfeed. So if you have a lot of stress during pregnancy, you cannot expect to deliver a healthy child. So it also affects the other hormones. This is what we have seen. Chronic stress and adrenal fatigue will have effects on growth hormone and prolactin. It also has effects on melatonin and caffeine, so you don't enjoy happiness, you don't enjoy good sleep. Now, many times you hear people have insomnia. Besides homocysteine, which affects your methylation and you are deficient in your vitamins and minerals, stress is a problem. So if you take a good history, you'll know. In the morning, they wake up feeling tired, and then they are moody, irritable, and angry, and they have carbohydrate cravings, and they have another slump in energy in the afternoon, and they can't sleep at night. The reason is because whenever the body is trying to compensate, you may end up producing more cortisol in the evening. And cortisol has an inverse relationship, and an opposite effect to melatonin. It will affect your melatonin levels, so you can't sleep. So one way of treating insomnia is looking at the stress level, and if they are in cortisol deficiency, correct the cortisol deficiency. And if they cannot sleep still with melatonin, then you may want to look at some relaxing neurotransmitters like GABA. Chronic stress also have effects on lymphocytes because they have these receptors. So you do not want to be in chronic stress. What does it do? When you have an acute stress, you have increased cortisol. That is necessary because you need to have more energy and better blood glucose, higher blood glucose. It suppresses your leptin because you don't want to have satiety, but it increases your ghrelin because it increases your appetite. You eat, and unfortunately, you have cravings only for carbs. But the food that optimizes your hormone is just the opposite. It is the protein and good fats. So when you are cortisol deficient, eating carbs is going to suppress your cortisol. But cortisol deficiency will only give you the likings for sugar and carbs. So it becomes a vicious cycle. If you do not recognize this and correct the cortisol deficiency, it is very difficult to make people eat their breakfast other than carbs, including your children. They will love only carbs, and they love their coffee, and they love their sugar, because that's what gives you instant energy. But you slump again after 2-3 hours. Then the catecholamines, of course, this is compensation for you to have instant energy. So you have increase in the heartbeat, you have vasoconstriction, especially in the intestinal area and stomach, because the blood needs to be diverted. You have bronchodilation, you have increase in blood glucose, and there is sodium retention. This is all compensatory. So this is all right if you have acute stress, okay? But you do not want to let it go for longer periods of time. Stress also affects the mind and the body, some of those emotional effects that I've just mentioned. Psychological stress is also associated with depression and infections. Now, the problem with stress is that we keep pushing ourselves until we almost collapse, because it looks apparently normal to push yourselves to work from 8 to 6 or 8 to 10 or whatever time, and you come back home, you still have to catch up with work, and chronic stress becomes habitual. So many of us will feel happy pushing ourselves to achieve the targets until you realize that you do not recover from infections. This is a very good clue to people in chronic stress and adrenal fatigue. They do not recover from acute stress. That is the clue. But that is already a late stage. So the idea is to recognize that you are stressing yourself by simply asking yourself how many hours you are working. Is it a continuous stress, or are you taking breaks in between? Because it is very easy to miss that. And if you miss it, you will go into adrenal fatigue. And then, because of the compensations that take place in the body and the biochemical and physiological changes, it leads to chronic diseases like cardiovascular disease. Because stress increases inflammation. Inflammation will lead to almost any disease, correct? And it increases obesity because you have more appetite for sugar and carbs. So it makes your cortisol even more deficient. Cancers, because you have increase in insulin, you eat more sugars, and then you don't rest, and there is more inflammation. Every one of these can be connected. If you understand the reasons behind, you'll be able to connect all these dots. You have hormonal imbalance that we will see, and you can also predispose yourself to autoimmune diseases. And all this can be very subtle unless you understand adrenal insufficiency and chronic fatigue. Now, otherwise what you'll do is you'll start treating only cardiovascular disease, you give appetite suppressants for obesity, or you treat cancers with chemotherapy and radiotherapy, leaving all the root causes behind. It induces behavioral changes. Usually you are angry and, of course, hungry. But when you become hostile, revengeful thoughts, that is a sign of adrenal fatigue. Cortisol deficiency, adrenal insufficiency usually stops here. You're always angry. How many of you in the morning wake up with a smile? Any hands up? My hands are down, of course. To be honest, it's down. It has to be down. Okay, it takes a little bit of time. I'm better now, anyway. My wife can attest to it. Am I a better person now? Oh, she says so. Okay, anyway, my hands cannot be up. How many of you, when you wake up, feel relaxed and enjoy your conversation? That means most of you wake up, you want to be just left alone for a while, just do what you have to do, rush and get your breakfast and go to work. That is already a sign of deficiencies. Okay? Then you have changes in the eating pattern, which I just mentioned. You like to eat carbs, and you have to eat more frequently. You always have to have frequent meals, and you're hungry. Changes in sleeping pattern, because it's difficult to enjoy good sleep. Very superficial, very disturbed sleep, and it could also lead to alcohol and substance abuse. Okay. Children can also have, I don't think it can also, I think most children are already under a lot of stress. You ask yourself, how many of you do not send your children for tuition classes? 1, 2, 3, 4, 5. The rest all push your children. I never had any tuition, when we all used to enjoy the childhood. If you do not enjoy the company with your children, you are just turning them into robots. I don't know where is the solution. Do we have to change the education system? I don't have the answers. I can't even change the way healthcare is practiced in this country unless I can change you all to think differently. But you can make the change. You want the change, you be the change yourself. You know who said this? Anybody? Mahatma Gandhi. So they can have psychosocial dwarfism. They are affected psychologically and even their growth. So they have reduced melatonin, they are not happy children, they are not happy, they have reduced growth hormones, so they can be short, they have delayed growth, puberty, and behavioral abnormalities. So I'm sure a lot of children see psychiatrists now, when it is simply giving them a better life, advising them to eat better food, and giving them breaks in between, holidays, and you need to spend time with your children. Now this, I'm sure most of you all will know, Hans Selye, he described the general adaptation syndrome, where you go from stage to stage. So stage 1 is where you get the alarm. Your mind and body responds to stress. There is increase in cortisol and adrenaline, and for the purpose which I've just mentioned. You need energy, you need certain areas need more blood flow, certain areas needs less blood flow. You need to think, you got to act, you got to run to save your life. That is supposed to be our lifestyle. This is acute stress when you see a snake or when you see a tiger. But unfortunately, I think there are lots of tigers around us now, so everybody is constantly stressed. We don't see good human beings. I don't think so. That's very common nowadays. So if you do not control that, you go into stage 2, where there is resistance. The body tries to pinpoint where the problem is and try to use other organs to fight. So there is not much of adrenaline and cortisol, and so it's left to the organs to fight. Okay? So this becomes a health issue, and it is still easy to reverse at this stage. Now, if you miss this, then you go into exhaustion, where you have exhaustion of specific organs, especially your immune system. You'll see more. You have adrenaline and cortisol further decline, and other organs roll in. This is where you get problems. Your adrenal cortex hypertrophies, you have atrophy of the thymus, spleen, and lymph nodes. Your WBC count drops, so you're more prone for infections and cancers, and you find yourself unable to focus and think clearly. You have always lived under stress, and that stress affects you, and you are not able to respond to stress anymore. You can't think straight. And then you'll notice that your short-term memory is affected. Now, stage 3 also involves increase in hydrochloric acid, increase in blood pressure, decrease in sex hormones, and an increase in LDL. Stress cooks the brain because it kills the neuron, especially hippocampus. Every time you're stressed, you lose memory, especially the short-term memory. So as you age, you realize one of the big problems is short-term memory. I had a class reunion on Friday night. This is my Form 5 classmates of 1974. It makes a lot of difference, you know, how you take care of yourself. So we all are some of us are already 60, some of us are close to 60, but there was a huge difference the way most of my classmates appear. They all looked very aged because, now why I'm saying this is, it's all in your hands. You should know how to take care of yourself. You should know how to avoid premature aging. You should know how to reverse aging. And you should always remember that optimum health and longevity is very much possible. There's so many things you can do. If you don't know what to do with yourself, how are you going to do it for your patients? But I could clearly see there is a lot of aging, very premature aging. And so they showed me photos. And everybody has to have a name tag, you know. Because some of them, I met them 40 years ago. I can't remember their names, and it takes a while for you to recollect the faces, because they've changed a lot. That told me one thing, that the memory is not good, because I lived my life with stress. I'm trying to just slow down. When I let go something, something else comes by. So it's never ending, but it affects your memory. So aging is inevitable, but don't age fast. Now, one problem with chronic stress is your gut. Gut problem affects the way you handle stress because it can give rise to adrenal insufficiency and adrenal fatigue. Adrenal insufficiency, adrenal fatigue can also lead to gut problems, basically because they increase the risk of gut dysbiosis, especially candida. And what happens when you have candida? Most of it is not recognized, so you end up taking antibiotics or PPIs. You have heard enough. So if a person has bloating, gastritis, reflux, constipation, white-coated tongue, all the classical signs and symptoms of candidiasis, including eczema, sinusitis, and allergies, then you should think about cortisol deficiency as well. And in my experience, if you treat candida, you have to optimize the hormones and antioxidants as well. This is the only time I use drugs, pharmaceutical drugs. And it's usually nystatin with a good diet. So stress can affect gut. Gut can affect your ability to handle stress and lead you to adrenal insufficiency and fatigue. So looking at causes of chronic stress, we have seen some of this is physical. You know what I'm talking about, emotional, psychological. You can also have lots of toxins in your body, in environmental toxins and heavy metals, because mostly they lead to chronic stress and your body has to handle the stress. And one of the reasons why we get stressed, why we get into adrenal insufficiency and adrenal fatigue is the food you eat. Now, the more white food that you eat, the more likely you are to be in adrenal insufficiency. Because white food, let me repeat, is devoid of all nutrients, and the body will have to undergo a lot of stress in digesting, absorbing, and eliminating. Whenever you eat foods that are devoid in nutrients, you will use up your reserve. Because almost all these foods are acidic. Your body has to lose its reserve to alkalize, keep your body alkaline. And when you lose your reserves of vitamins and minerals, you become more prone for adrenal insufficiency effects and adrenal fatigue. The worst things to eat in the morning will be the white foods. Not at any time, but the worst time to eat will be in the morning. Anybody had a breakfast without carbohydrate today? 1, 2, 3, 4, 5, 6, 7, 8, 9. This side is none. Anyway, so this side mostly new doctors, is it? So we'll teach you. Along the way, you'll learn. I'll have some slides on breakfast, what you can eat. And the next lecture, I'll give you some more idea about diet. Please change, and please change the way your children eat. So this is how gut dysbiosis leads to adrenal stress. It overexcites your HPA axis, And this has been proven again and again in many studies that if you give probiotics, you are able to handle stress better because it helps your gut to heal. So if you want to handle adrenal insufficiency and adrenal fatigue, the take-home message is also that you must look after your gut. So it's very easy. You just have to ask them symptoms of gut dysbiosis like gastritis, bloating, reflux, constipation, and look for outside the gut symptoms. If someone has sinusitis, someone who is always having rhinitis, somebody has eczema, likely cause is in the gut, not in the skin. Okay? Always look at the root causes. Think about what causes the problem. Don't think about drugs. Inadequate sleep, because even our children, they go to bed late and they wake up early. You must go to bed early and wake up early, that's fine. Catch up with your work in the early hours of the morning, that's fine. Going to bed late is never a good sign. So, and you don't relax, this is a problem, including myself. We have been thinking about having a holiday many months already, maybe 2 years. Just can't have a break. But that is not an excuse. At least you can have a break on Sundays. Okay? Perfectionism is a problem for most of us. We just want everything to be perfect. So you become less tolerant to people's mistakes. And this is going to affect you than the person who's not so perfect. So sometimes you have to change our attitude, the way we look at things. Of course, alcohol and drugs. Long-term use of synthetic steroids. Unfortunately, what we learn in medical school is all about synthetic drugs. Otherwise, most of you all will not be prescribing contraceptive pills. How many of you all use OCPs in your clinics? Just be honest. How many of you all prescribe contraceptive pills? Oh, then how come they are making billions of dollars if only 2 of you are using? They make billions, am I right? Then how come so few doctors are using and then they make so much of money? Anyway, sometimes, yes, okay. Or buying over the counter. So you are not cortisol deficient because you can think fast. Now, whatever it is, contraceptive pills are synthetic, what we freely prescribe. And government hospitals also give it as free form of contraception. Am I right? But the hormones belong to horses. So you are just turning women into horses. So, and marriage life also will shatter. They are synthetic hormones, but you use it freely. But how often you hear patients coming back and telling you that they have spoken to other doctors or their friends and they have been told not to take hydrocortisone. Have you heard this from patients? Very often. But they have no problems in prescribing prednisolone. So this is a difference between what you have been taught and what we teach you. I'm not saying this is the only thing that is correct, but you will have to always weigh things. So do not go into synthetic drugs if you can. Now, let's talk about adrenal insufficiency and the hormones. It can cause DHA deficiency, cortisol deficiency, aldosterone deficiency, and other hormones. We can't cover all the hormones. We'll talk about cortisol, we'll talk about DHA, and I'll mention some about aldosterone. Now, when you have chronic stress, besides the hormones that I've just mentioned, it will also affect your GnRH. So you will have suppressed gonadal hormones. So you have lower levels of estrogen, progesterone, and testosterone because they also come from adrenal glands, not only from ovaries. Now, these suppressed gonadal hormones can present as irregular cycles and amenorrhea in girls, young girls, and women. You would have seen sports women being amenorrheic, and they are very thin. They also suffer from osteoporosis. So amenorrhea is probably because of this. Osteoporosis is because of testosterone deficiency. And this gives rise to oligospermia and decreased motility and impotence in men. So it can affect both sexes. So prolonged stress can affect reproductive functions. Why you need to remember? If someone comes to you for infertility, the solution is not clomiphene, the solution is not IUI, the solution is not IVF. You can advise, but ask yourself whether you have addressed all other causes or not. Are they eating a healthy diet? Are they managing their stress well? Have you balanced their nutrients? Have you balanced their hormones? And then try to conceive, because then it will result in healthier pregnancy. And the chances of taking home a healthy baby is much higher. What is the success rate of IVF? Can anybody tell me? 30%? What happens to the 70%? It's a very sophisticated technique, right? What happens to the 70%? Either they conceive or they lose. And some of these children also have psychological problems. Now, the reason is because IVF is done without optimizing health for the couples. So you can be different. You don't do IVF, but at least you got to guide people, right? You tell them to exhaust all these options first for 3 to 6 months, and then take some clomiphene treatment or IUI. If it doesn't fail, then go for IVF, because you all are general practitioners mostly. Patients, a lot of patients come to you, and then you refer to specialists. But before you make that referral, enlighten them. Now, cortisol deficiency, I'm sure most of you all will be interested, but this is not about cortisol only, so I didn't put a lot of slides, okay? Now, typically how a cortisol deficient patient will look like, they are thin, including thin, hollow cheeks. They have dark circles under the eyes. Few other reasons for dark circles: if you have chronic food allergy, you haven't slept, you don't sleep well, cortisol deficiency, okay? And you can also have dark pigmentation under the skin folds, your elbows, your creases. Yeah? Generally, you have a darkened complexion as you age. Am I right? So you go to a great lengths in whitening yourself. Yeah. That's what aesthetics, they have a big business. You can have hypotension. So patients usually complain of giddiness. They are nervous, restless, and always have an anxious look. Okay. You can't have a conversation with cortisol deficient patients without you observing that they talk fast. They're always anxious. Okay. And some patients is classical. They'll have wet palms. So they will have often problems like eczema, acne, age spots, and tense muscles. Any other reason for tense muscles? Nutrient deficiency, which one? Which one? Magnesium. Oh, so we can stop all the subsequent modules, because you all are very well versed with nutrients. Now, morning sickness in pregnancy. How many of you all see pregnant ladies who suffer from morning sickness? Nobody? Oh, okay. You know what is the cause for morning sickness? Sorry? Some more? Cortisol deficiency plays a big role in morning sickness. B vitamin deficiency, especially B6, and mineral deficiency. It is not because they are deficient in antiemetics. I don't use. All you have to do is to think what causes morning sickness. It's not a deficiency of drugs anyway. So remember, a patient with hyperemesis in pregnancy likely to be cortisol deficient. Okay? And the other hormones like progesterone, and they also usually deficient in vitamins and minerals, especially B vitamins. The symptoms, this is very classical. I'm sure if I were to say this, you have to close your eyes and ask yourself, okay, you are the type who will often say, you will notice that nothing makes you happy. Your wife cooks good food for you and says, how is the food? Okay. How was the movie? Okay. Nothing makes you happy. You are not going to hug your wife and say, fantastic food. Do I do that? I think I'm doing it now at least. And then the common complaint is everybody is a troublemaker. Everybody around you is either they are not smart and they are either lazy, they are not perfect and they keep making mistakes. It's just irritation, irritation, irritation. Nothing is out there, nothing is good for you to be happy about. Now tell me how many of you all haven't gone through this? Or how many of you all do not now live in this world? A situation like this. Most of us will do, especially doctors. Who are the most stressed? Doctors? Jockeys? Racing car drivers. I don't think so racing car is that stressful, you know. Especially if you drive a fast car, I don't think so. But of course, you don't go on the racing track. You cannot miss meals because you are often hypoglycemic. And you always have the carbs and sugar cravings. But don't forget this, because we'll run late otherwise, so I can't ask you to close your eyes and analyze yourself. At least when you go back home, you can ask yourself, anything makes you happy or most things make you unhappy? You can't handle stress well, you're less productive at work. Most of the corporate companies understand this, so they have lots of programs to help their staff. Give them some breaks in between, they have activities organized. There are two things that they do. One is to understand that staff who have acute or chronic stress become less productive. Absenteeism is a bigger problem in companies. No, presenteeism is more a problem than absenteeism. You might as well not come to work. You go there and sit like a robot and do not perform your work or make a lot of mistakes is becoming a bigger problem than you not turning up for work. And the other one is corporate social responsibility, CSR, where the corporate giants nowadays involve in giving back to the society. You have short-term memory loss, and you are not able to recall quickly. I told you my reunion experience. Yeah. Poor concentration, sweaty palms, very typical of cortisol deficiency. And you feel the butterflies in your stomach. I haven't felt it. I can't describe exactly how it feels. Energy and mood. You are the type who feel night is the best time to work. Whereas if your cortisol is sufficient, you will have all the energy you need during the daytime, morning and afternoon. And you'll need to rest. You will understand your body biology very easily. You sleep well early hours in the morning. You will wake up late, and then when you wake up, everybody is bad. They have to move away from you. Now, DHA deficiency doesn't give you a lot of symptoms like cortisol deficiency, but it has many effects on health. Because DHA, it does about 150 functions in your body, but it is the hormone that decides the strength of your immune system. And it is the hormone that is called as a predicting hormone, which means you will become deficient first before a clinical sign and symptoms or a disease set in. And this is at least 10 to 15 years before. So if a person is DHA deficient, these are the people who are likely to get chronic degenerative diseases and cancers and autoimmune diseases. So it could precede at least by 10 to 15 years. Why I'm saying this is monitoring is very important. Whenever you test hormones, there are some hormones is a must. You have to test thyroid, adrenals, hormones like cortisol and DHA. You have to test your fasting insulins. This is a smaller package. But if you want to do the rest of the hormones, you can always work with the labs. So DHA deficiency, you will not have a lot of clinical symptoms in the acute phase. And DHA deficiency increases infertility because it affects ovulation. Now, about 7 years ago, I mentioned to some of my ONG colleagues of mine to start using DHA higher dose, about 75 milligrams, 3 months before they do IVF, because it improves ovulation and increases the successful outcome of a pregnancy. And I was supposed to be invited for a talk at the ONG Society of Malaysia, but it didn't happen. But now I understand those who practice IVF, some doctors at least have started using DHA. So things are changing. So you're not the only one who's changing. There are things happening around you as well. Hopefully it happens in a bigger scale. So we can take it up all with the Ministry of Health. Okay. Now again, I've got an invitation by the OGSM Society to speak on bioidentical hormones for menopausal women. It happens to be on the 5th of June, so we may have to change the date for the next conference. Probably it will be the last week of May. Why I want to do that is it's better for me to go and speak when I'm invited so that I can also bring some of them to attend. Why is it important? Tell me. Because the only way to have a healthier generation, the next generation, is to teach and train ONG doctors and general practitioners to prepare women and the couple especially, before pregnancy and watch them during pregnancy. And one of the most important hormones that you need to look at during pregnancy is thyroid hormone. So aldosterone deficiency, it's a salt and water retaining hormone. You will feel dehydrated, you feel thirsty even after drinking water, you have low blood pressure and syncopes, you feel better lying down. Okay. Now, why don't you all concentrate in the lectures? You can always get the CD if you want to, or you can come back and sit in my clinic and learn. Because if you spend time, some of the important things that I'm saying you will miss out. Yeah, just concentrate on the lectures. And you have premature aged look with wrinkles. Is there any other hormone that you can use to reduce wrinkles? A lot of you practice aesthetic medicine. What are the hormones? Vasopressin. It reduces wrinkles. Crow feet, especially, all the fine wrinkles, they are dehydration. So aldosterone and vasopressin can give you a younger look. Long-term effects, you will have mood swings and depression. You have organ dysfunctions, you have immune dysfunction. Some of these I've already mentioned. Effects on other hormones like your estrogen, progesterone, and testosterone. Effects on gut, chronic stress leads to inflammation. Inflammation can lead to leaky gut syndrome, and you have the whole lot of problems after that. It can also lead to premature aging because of DHEA, melatonin, growth hormone, and thyroid hormones. Remember this, adrenal insufficiency and adrenal fatigue will have problems primarily because of deficiencies from adrenal hormones. They can have secondary effects because of the effects on other hormones and things like chronic inflammation and gut dysbiosis. So it is not just about adrenal health, okay? So it can lead to premature aging because it shortens the telomeres, and there is a lot of oxidative stress because of chronic inflammation and gut dysbiosis. Eating white foods will also lead to chronic stress in your body, and you become depleted in your antioxidants. So watch your diet. Now, there is always a connection, almost always a connection between thyroid and adrenal glands. Someone who's like, for example, cortisol deficient, they are almost always likely to be deficient in thyroid hormone. Very simple. I've told you the classical symptoms of cortisol deficiency. You ask them if they have signs and symptoms of thyroid deficiency. Very simple. Cold hands and cold feet, dry skin, hair loss, feeling tired, especially in the morning, cracked feet, constipation, more eczemas, pregnancy loss, neonatal jaundice, poor lactation, children who are always sick, they deliver babies who have less hair on their head. All these are signs of thyroid deficiency. One hormone but can have multiple presentations. So it can increase cholesterol levels. So if it is a cardiovascular disease, you see a cardiologist. If you have dry skin, of course, you use all the cosmetics instead of thinking about thyroid hormones. If you have a poor immune system, it leads to a lot of problems as well. So thyroid and adrenals, they always work, almost always work hand in hand. And cortisol deficiency will also result in poor conversion of T4 to T3. T4 is the hormone that your thyroid produces. T3 is the metabolically active hormone. So cortisol deficiency will decrease the conversion of T4 to T3. So even if your T4 is normal, you will still be hypothyroid. That's why it's also good to check your free T3 as well. TSH, first time, yes, you don't need to follow up with TSH unless you are repeating the test in pregnant women. Why this is important is when you increase cortisol, you may have to increase thyroid as well because they work in synergy. Now, another reason why you have problems in recovery is, now if you have a cortisol deficiency or a thyroid deficiency, acute stress can precipitate a crisis. It is important to recognize this, especially in chronic fatigue patients, because you want them to heal, it's going to take a long time, 6 months, a year or 2, or even longer. So during this period, you should avoid another episode of acute stress. Now, another effect of chronic stress is there is increased conversion of progesterone to cortisol. Progesterone is the mother hormone. When the body needs more cortisol, if it doesn't come from your adrenal gland, the body knows what to do because the body is always intelligent. We are not as intelligent as our bodies. You only think with the brain, but the body has many other compensatory mechanisms. So the progesterone will be converted to cortisol, leaving women and men progesterone deficient. What does it lead to? Progesterone deficiency. You have premenstrual syndromes, you have dysmenorrhea, you have heavy menses, you have an increased risk of breast lumps, ovarian cysts, endometriosis, fibroids, pregnancy loss, and many more. Where is the root cause? It could be just cortisol deficiency. Okay, so hormones, you have to look at them as a family. I usually do not believe in correcting single hormones. It is always better to understand the interplay between the hormones. So when you have an increased risk of estrogen, a relative increase in relation to progesterone, then it is easy to treat because you have to replace the progesterone. But if you want to optimize your treatment, you have to look at cortisol deficiency as well. Growth hormone, when you are in acute stress, you have increase in growth hormone because you need more metabolic activity, but chronic stress will suppress your growth hormone. And that is one reason why people who are chronically stressed age faster. What happens when you are under stress? Your insulin decreases, giving rise to hyperglycemia. And that is not good, because you have the risk of obesity and diabetes, and hyperglycemia suppresses your immune system. So it affects many other hormones as well. Now, stress affects immune system. You heard about it yesterday. There are two types. One is cellular immunity. That is by neutrophils, controlled by neutrophils, macrophages, your eosinophils, and natural killer cells. They are quick, and they are all-purpose. They are not very specific, and complements are involved where there can be also inflammation. This is the Th1 part of the CD4, and they usually work against intracellular pathogens like viruses. Okay? So if your cellular immunity is affected, you are more prone for viral infections. This is cellular immunity. And you have the other arm, which is humoral immunity, which is specific, involving T cells and B cells. And T cells, they work like this. They identify and they go for a kill. And they'll rope in others to help them. That is basically the function of T cells. And the B cells are the ones that produce antibodies. And they usually work against extracellular pathogens. So if you have an imbalance of TH and TH1 and 2, like for example, if you have more TH2, then you're more prone for allergies. Okay? So this can be a result of chronic stress. Now, acute stress suppresses cellular immunity. So you have suppressed TH1, so you have more infections. Have you noticed people who attend workshops and conferences, Not Saham conference, eh? I'm talking about other conferences. Here you are happy. You learn, you are happy, you become better doctors, you become stronger. So not this conference. Those who attend workshops and conferences, post-workshop, post-conference, they get sick. Am I right? The reason is because of stress. Do not blame the virus all the time. You become deficient in a few things. Cortisol, you become deficient in vitamin C, you become deficient in glutathione. Anytime you have a lot of stress, it is better to optimize this. Take a lot of vitamin C, you definitely require a higher dose, and make sure you have enough glutathione and watch your cortisol intake. Talking is stressful. Usually I take 10 milligrams in the morning, but remember you have to take hydrocortisone another 4 to 6 hours later because you don't want to slump. Now, many of you forget to take your hydrocortisone, the second dose. Please don't do that because that itself adds to the stress. You optimize in the morning and suddenly you slump later because you become deficient. Itself is a stress. Try to remember, hydrocortisone must be taken twice a day at least. Usually you don't need 3 times unless somebody is sick. Now, chronic stress involves both the cellular and humoral immunity. That's when you get a lot of increase in infections and cancers and metabolic disorders. Stress increases inflammation because it promotes the expression of inflammatory genes. And you all know that chronic inflammation is the underlying cause of almost all the diseases that you have heard of. Stress is also associated with high homocysteine. Okay. Now, besides looking at methylation pathway and using folic acid, B6, B12, zinc, and probably magnesium as well, look at stress as one of the reasons for high homocysteine. Now, we'll skip this. There are many phases. Now, the hallmark of adrenal fatigue. I mentioned to you about adrenal insufficiency. The next phase will be where you get into fatigue. The hallmark of this is someone who has slower recovery from infections. You go on stressing yourself, then each time you get an infection, which is usually virus or bacteria, you take longer to recover. And the patients who are in hospitalized patients, these are the patients who will end up in ICU. So when you have a patient who is chronic with acute infection who ends up in ICU, one of the treatment will be optimizing cortisol level. And sometimes you will have to use even the intravenous route. So it is often an infection, acute emotional stress that will precipitate a crisis in someone who has already been suffering from chronic stress. So it's very easy to push yourself from adrenal insufficiency to adrenal fatigue. Now, this is what physicians need to understand, especially when they are dealing with patients with chronic degenerative diseases or cancers. And the moment they get an infection, it is not only antibiotics that is going to give a recovery. You have to look at the rest of the factors. And hydrocortisone or cortisol plays a huge role in this. Adrenal fatigue patients are often sick. They have flus and allergies, generally unwell and lethargic. Any kind of stress, they become very tired. There is a possibility of weight gain, especially around the waist, because I told you it increases your blood sugar. It increases your cravings for sugar and carbs. The more carbs you eat, the more hungry you are. Okay? The ability to complete tasks will also be difficult. You don't meet your deadline. So what happens is, you have to meet your deadline, so you push yourself into overdrive. And you do not recover. Mood disorders, brain fog, and insomnia. You can have hypoglycemia, hypotension, syncope, which we have seen, dehydrated even after drinking water, aldosterone deficiency, low energy most of the time, cortisol deficiency, thyroid deficiency, testosterone deficiency, and growth hormone deficiency. But the classical symptom of fatigue and tiredness will be in the morning. There are only two hormones you got to look at, cortisol and thyroid. You feel better lying down, it's aldosterone. Pedal edema is aldosterone. Sugar, salt, and caffeine cravings, especially in the morning and mid-afternoon. Please don't do that because it is going to give you more energy. It's okay to drink during conference. I also drink coffee. Okay. Otherwise, I keep it to weekends. Yeah, but that shouldn't be the reason to. That's only going to give you a temporary increase in energy. And you cannot relax. I used to be like this, When I go for holidays, I will start thinking about, the first day I can relax, second day cannot. I will start thinking about, oh, I've got so much work to do. When I go back, I have to see so many patients, I've got this to do, that to do. Typical sign of cortisol deficiency, and we all doctors have this. You just cannot relax. I can give you the best resort, you won't relax. You can also suffer from fibromyalgia and chronic fatigue syndrome, inflammation, nutrient deficiencies. Remember, cortisol deficiency makes you eat rubbish. Alcoholism, cardiovascular disease, we have seen, autoimmune diseases that I've mentioned. And you can also have tinnitus. What is the hormone deficiency in tinnitus? DHEA. You can have anxiety, increased fears, depression, poor concentration, poor memory recall. We have already seen all this. Then you go into burnout syndrome. The typical would be you become very pessimistic, you have social withdrawal, substance abuse, sense of hopelessness, cynical, suicidal tendency. There is not a lot of difference between adrenal fatigue and burnout. It's just you are totally exhausted. And that is when life means nothing to you. Okay? Now, Addison's disease is an autoimmune disease. It's very rare. What would you do? This is the old way of testing, iris contraction. You can check the patient's blood pressure when they are sitting and when they stand to detect postural hypotension. Usually there will be, in a healthy person, there will be a rise. You don't get this in deficient patients. Sargent's white line is when you stroke. And it will be white and then it turns red, but in these patients it will remain white for a longer time, up to 2 minutes. Sorry, how many more minutes? Okay. Today is a relaxed day, so we can be flexible a little bit about time. Is that okay? Yeah. I don't like to work within schedules. Saliva, you have 3 types of testing for hormones. You can do saliva, you can do blood, you can do 24-hour urine. I prefer blood because it's just convenient. The patient comes fasting, you draw a sample, and they go back, although it's not the best. None of these tests is the best. Sometimes you will have to do more than one type of investigation. Saliva is very useful for cortisol, but you'll have to do multiple times. It gives you the free form, but you'll have to do in the morning between 6 to a.m., between 12 to 3 p.m., 6 p.m., and 12 midnight. Okay? This is a reliable way of assessing your cellular levels of hormones. Sometimes you have, because hormones, there's an issue of protein binding. When you do blood tests, you measure the unbound form, which is a small percentage. Most of it is bound, so you don't get to test. When you do saliva, you test the cellular levels. When you test the urine, you get the metabolites. So there are different ways of testing. So the blood test, usually only the free form is tested, but this is convenient unless a patient doesn't want needles. Okay? Some patients don't want needles, especially if you have done it before. That is probably because you are not good at drawing blood. Okay, you put the fear into them. How many of you all draw blood from children? Oh, okay, good. Sometimes you have fatigue symptoms under stress when the reserve is low, but the blood levels will show normal. Now, what you should do when you have hormone levels, always use the patient. Look at the clinical signs and symptoms as well. And I do not repeat many of these tests. I do a baseline and I work with the patient, clinical signs and symptoms. Very easy to do for almost all the hormones, especially thyroid and cortisol. Very easy, even testosterone. So do not subject them to repeated blood tests. But what you need to do is to watch for some of the conversions. Like, for example, if you prescribe testosterone to a patient, you should know that testosterone can be converted to estradiol and dihydrotestosterone. That you have to monitor. You understand what I'm saying? You don't have to keep testing testosterone all the time. If you can assess clinically, you should be trained. You can also do 24-hour urine level where you can test the hormones as well as metabolites. Okay? But you will miss the peaks and the troughs. So the ups and downs you may miss. So that means you have to combine with the salivary testing. I don't do this. You can do an ACTH challenge test. You should have at least double the level of cortisol after giving ACTH. Because it's apparent, very easy to detect cortisol deficiency in patients. You only need to watch them, observe them, and take a good history. So how do you handle adrenal fatigue? You manage the stress. Meditation is a very good way of managing stress. I tell all my patients, when you wake up, do not rush, have your shower, sit down, sit in silence, and do some relaxation, deep breathing, or meditation. That helps you to handle stress better. You must have good sleep. Melatonin and GABA will help you with that if you have problems. A healthy diet is important. We'll talk in the next lecture. Look at gut dysbiosis. If there is, you should also treat. And you should look at food allergies and mold. Detoxify heavy metals through chelation. And you should not stress the body any further with alcohol and drug abuse. So you should just look at all this, not only hormone replacement. Now the mainstay of treatment would be hydrocortisone. Hydrocortisone is natural as long as you use less than 30 milligrams a day. 30 milligrams or less, you are not going to suppress the adrenal gland. It's when the dose exceeds 30 milligrams. So generally the dose is 10 milligrams for adults, 10 milligrams in the morning and 5 milligrams 4 to 6 hours later. That is a sufficient dose. I use higher dose and frequent dosing if I'm treating someone with an acute infection like flu. I use a lot of vitamin C. Again, you heard about it yesterday, a high dose, a high stat dose, and very frequent dosing with hydrocortisone and zinc, and most of them are okay by evening or the next day. They do not require these paracetamols and antibiotics and other drugs. You should look at, did I change that? Okay. You should also look at DHEA and consider aldosterone as well. Look at the other hormones. Oh, okay. This is a reflection of acute stress. So the replacement has moved down. Sorry about this. So this hydrocortisone is bioidentical. The daily synthesis 20 to 30 milligrams. It is very effective for energy and mood and to keep you relaxed. But it's less effective for inflammation unless you use a very much higher dose. Someone who needs to control the inflammation, maybe for 2 to 3 days, you may want to consider prednisolone. The possibility of water retention is there, but usually I do not have these problems with patients. And if they do have, you have a choice of switching the hormones, or you can add potassium as a mineral. Always remember higher dose in the morning and a smaller dose in the afternoon. DHEA you have to combine with cortisol. Cortisol is a catabolic hormone. You have to balance it with anabolic hormone. And this is the hormone that is going to help you to manage stress as well as to prevent some of the chronic degenerative diseases like diabetes, cancers, as well as autoimmune diseases. You shouldn't leave anyone deficient. When you correct cortisol, remember the negative feedback mechanism, so you could make someone DHEA deficient. So please remember, you have to correct the two hormones together. There are many other benefits of DHEA, including immune boosting effects. It's anti-obesity because it helps you with weight loss. And I told you just now about it being a predicting hormone. The general dose is 25 to 50 milligrams in women, in men, and a smaller dose in women. If you are giving it to a woman, you must advise them to stop or reduce the dose if they get oily skin, acne. If you do not treat that, then they'll get facial hirsutism. Most of this is reversible. But it is always good to advise your patients. You want to avoid getting into conflicts and problems. Tell them the good things about the hormones and how to watch the excess dose. I will not call it a side effect if you have used excessive dose. Or the standard dose could be too much for a person. You have to do that with DHEA, you have to do that with testosterone, and you have to do that with thyroid hormone. Thyroid hormone, if you use the standard dose, for majority will be okay. Some patients will have too much, and they'll have tachycardia, palpitation. They just don't feel well, and some of them will feel very sick, and they'll come to you. And they'll come after you. That is when you get into problem. A simple 1-minute explanation, okay, will avoid all these problems for you, headaches. Pregnenolone is the grandmother of all hormones. You know, from cholesterol, the cascade is to pregnenolone to progesterone, and from there all your steroidal hormones are made. So it can act as a precursor to many hormones. Your cortisol, DHEA, sex hormones. The dose is generally 100 to 300 milligrams. Aging people, it's good to take because it's also a good hormone to protect your neurons. And if you are going to eat in Chinese restaurant, if you are worried about the MSG effects, you can always take some pregnenolone before you go because it has got significant neuroprotective effects. But generally the dose is 100 to 300 milligrams. It has to be taken in an empty stomach. Now, progesterone acts as a precursor. It is next level, next cascade from the pregnenolone. And men above the age of 30 could also consider to reduce the risk of prostate hyperplasia because as you age, you have a tendency to have excess estradiol. And that is not good for prostate, that is not good for erection, that is not good for the heart. So you may want to consider. But always test your hormone levels first. The dose is 30 to 50 milligrams. Oral forms, they come in 100 milligrams soft gels. Now, I mentioned to you just now, 5 minutes, okay. I'm the president, right? So I have another 10 minutes? No? They are very strict. They are very strict also. Anyway, I told you about breakfast. If you want to optimize your hormone levels, breakfast should have fats, proteins, vegetables, nuts and seeds, no carbs, no coffee first thing in the morning, and no sugar. If you take a carbohydrate breakfast, then it will be like some of you are already dozing off. Yeah? So you should avoid coffee, you should also avoid sugar. Now imagine you give this breakfast to your children, and you rush them to school and to tuition centers all the time feeding them carbs. That's not good, right? So remember this for breakfast. That doesn't mean that I'm going to sit and watch in the next conference what you're eating. You all are all matured adults. You can decide for yourself. Vitamin C is very important for adrenal gland, heavily concentrated in adrenals. Stress depletes vitamin C. Optimum dose is always needed, and dose yourself to bowel tolerance when you're under stress. And you heard yesterday, you can only get to a certain level with oral dosing. If you are under acute stress, if you need to recover from an illness or you're fighting serious disorders, then you will have to consider the intravenous form as well.
Sorry, about the coffee, shall we advise our patients as well to avoid tea when it's black or not? There is a big question.
Tea, there is caffeine there as well, but it's much less. But what I advise my patients is to have some green tea or herbal tea.
Okay, so no black tea first in the morning either.
First thing in the morning. You can enjoy your coffee if you want later.
Okay.
Like I'm going to have a cup of coffee after this. I think that's... So consider increasing the vitamin C dose when you are under stress. Glutathione, you heard about it yesterday. This is the master intracellular antioxidant. It is the master detoxifier. It is also the master immune booster. You shouldn't swallow glutathione molecule because it's large. A lot of it is going to be wasted. You should take the precursors. Okay? Cysteine, glycine, and glutamine. So cysteine is the most important one. So some preparations will have only cysteine, some will have all the three. But this is very important. In the next lecture, you'll also hear some about glutathione, why it is an important antioxidant that all of us need to optimize. By acute and chronic adrenal insufficiency or adrenal fatigue. You can take adrenal extracts. I don't have much experience. You can talk to some of the exhibitors who have these products, but they do help those who need to recover from adrenal fatigue. Adrenal insufficiency, you should be able to manage with all the facts that I've given so far. Now, this is a questionnaire that you can always ask your patients, but simple questions like their energy and mood in the morning. And when you ask about mood, when you ask about energy, talk to the patient directly. When you ask about mood, look at the partner. You ask the question to the patient, but look at the partner. He or she will give you the answer. And you can have a lot of other questions like about being always non-appreciative. They have cravings for sugar, caffeine, and carbs, frequent hunger, hypotension, syncopes, so hypoglycemia. Many of these symptoms will give you a clue. And there are lots of references at the end of this. Okay. Any questions? We can take a few questions. Yes. If you want to do testing throughout the day, then the saliva is better. Because you can give them the tubes and ask them to collect and send it to you. Otherwise, you'll have to ask the patient to come to you several times a day to have the blood drawn. And most patients wouldn't want to do that.
So when you give the hydrocortisone, should it be in time according also to the extraction of the blood, or what is the best time to extract?
In the morning.
Okay.
In the morning. Mm-hmm. I do not do the afternoon level.
Okay.
I ask my patients to come fasted, where I do all the hormones. I don't do a repeat because it's practicality. And patients don't like to come back in the afternoon and have another blood drawn. I am a clinician. I put my knowledge, but I do a lot of clinical evaluation. Okay. That's why I mentioned to you just now, I won't repeat a lot of these blood tests. I do one for baseline. Most of them I monitor. Because the patient himself or herself will give you all the clues, whether they are feeling healthier. But as a clinician, you have to have the knowledge and evaluate them. But some tests need to be done. If, like for example, I mentioned to you, if someone is on testosterone, you have to monitor the estradiol and DHT.
Yeah. That's very practical because all these tests are very expensive.
Which one, sorry? Yes, of course. But always practice hormones the safe way. Always have a baseline. You have to have a good justification for prescription. What I'm saying is whether you want to repeat every test after maybe a month, but because you give them hormones and the next morning you're going to ask them come fasted. So the levels will not accurately reflect what's in the body. So some tests, if you really want to know how much to give, like DHEA, you ask them to take for about 3 to 5 days to a week, ask them to take in the evening or early night, and then you do the test the next morning. That is a better reflection. But you can't do that for cortisol. Yes?
It's got a patient with metabolic syndrome and also adrenal insufficiency.
Mm-hmm.
They have high insulin level and low cortisol. So when do you start correcting the cortisol? When the insulin level is still very high?
in my opinion, I would correct them simultaneously. In the next one, I'll let you know about metabolic syndrome. What actually causes most of these problems is because of your carbohydrate intake. So you'll have to handle that. I told you just now, to be a good clinician, you will have to equip your knowledge, yourself with knowledge to advise patients about diet, and you have to know the nutrients and the hormones that need to be replaced and the way to detoxify. So someone has metabolic syndrome. If they are cortisol deficient, it's difficult to handle this, right? You have to change the diet, but you also have to push up the cortisol level. Otherwise, they'll have sugar cravings. They are hungry all the time. And when they are hungry, they like to eat carbs, and that is very detrimental to adrenal hormones. Does that answer your question?
Partly because I have issues.
So you sort out your diet, which I can tell you in the next lecture, but you have to replace the hydrocortisone. For adults, what I've seen over the years is that when you replace the hormones, you take it long term. Because the older you are, the less you produce. Okay? Only increase at times of acute stress, like what I mentioned. But for children, I have no reservations in giving them thyroid hormones. But if I were to give hydrocortisone, I would use a smaller dose for a short period of time. Like some children who are often sick, you give them a small dose of hydrocortisone for 1 to 3 months, and then they are fine. After that, they do not require. You just have to educate the parents. But in your case, you'll have to do both. Yeah, Baljit?
Excellent lecture.
Thank you.
You know, the process of taking blood itself is usually a stressful event
Yes,
for patients.
yes.
Very often when I do cortisol, I find that it doesn't correlate with the patient's symptoms. I'm wondering whether the stress of the needle prick itself can cause cortisol to go up.
Yes, you are right. So the solution is to go for saliva or be a smart clinician. You get the level, but it doesn't fit in with your clinical evaluation. So you'll have to ask all the questions that I mentioned to you. If they have most or all the symptoms, then you will have to explain to the patient, look, the results do not show that. But I think probably because you are already stressed out, fasting, because people love to eat as many times as they can, and then the stress of seeing a doctor, waiting, and the needle. So you explain and you put a remark there.
The value of ACTH itself in seeing whether there's adrenal insufficiency?
I don't do. I have not done the test, but you must have at least double the level before and after. To me, the practice, I keep it quite simple. I know how to deal with adrenal insufficiency, acute and chronic, and adrenal fatigue. So I do a baseline blood test results. I don't do saliva often. I don't do urine 24. It's just that we don't have the patients our patients seem to be different. They are not compliant. They just want to come. They want to have the easiest way and just draw the blood and go back. So you have to put all this together in your practice.
Thank you.
Okay.
For prostate cancer patient on anti-testosterone, is it advisable for cancer patient with prostate cancer on anti-estrogen regimen? Are you advisable for this hormone cortisol replacement?
No harm. No harm. Yeah, of course. The concern is always the testosterone, which honestly I don't believe it's the cause. Because when do you see most of the prostate cancers? In what age group? Past 50, past 60. When do you become hormone deficient? Around the age of 25. Okay. So if you say testosterone causes cancer, after 10 to 15 years or even 20 years of using, then most men below the age of 50 should get cancer prostate if testosterone is the cause. Whereas you see in older men who are so testosterone deficient. So that's another topic. But you can use thyroid, you can use hydrocortisone. The hormones that get converted to estrogen, you'll just have to be more careful. Like DHA, testosterone, you want to be careful.
Submitted. Thank you.
It's a standard advice, not standard advice, it's advised that usually you correct the thyroids, then you go to the cortisol, but thyroid hormones is always taken on an empty stomach. But when you are trying to help a patient recover from illnesses, then you will have, I use both together. But if there is a need to increase any one of these hormones, I will look at evaluate it clinically. But you can always use thyroid first because that's the master of orchestra. Then call them back a couple of weeks' time, then you give them the hydrocortisone. That is the problem, because most of the time when they are so hypothyroid, they are also so cortisol deficient. So what I do is in order to keep the compliance good, because you correct one and they still have all these mood disorders and tiredness and cravings, they are not going to come back to you. They'll ask this question, I spent so much of money, I went to see the doctor, and I still don't feel right. So what I do is I correct both at the same time. Yeah? No. Your biochemical evidence with clinical evidence. Okay?
Dato', just one comment.
Yes.
Yeah.
How many more questions, Lekun? This is the last one?
Okay.
Okay.
Sorry.
Yeah, Dato'.
Basically, adrenal insufficiency is very common, actually. In my practice, I think I've got easily 200 patients, actually. 200 patients, not little. Because when you look for it, you'll find it, actually. Because most patients will come and tell you they're tired, in the evening especially. And they're not only tired, they feel aching, they feel sleepy. That's me, because I have adrenal insufficiency also. So I know how it feels like. Now, basically, most of us, when you get the symptoms sometimes, you do a blood test, cortisol. It's within normal limits. Now, there's a book called Safe Uses of Cortisol by William Jeffries, Professor William Jeffries in America. It's a interesting book. If you read that book, it's fantastic. It tells you there is something called mild adrenal insufficiency. That means the patient has normal cortisol, but under stress, it doesn't go up. You understand? So when it doesn't go in the evening, they get very tired. So what he does is that he doesn't do a synectin test. See, synectin test is very difficult. You give ST stimulation test, you know. But what he does, he gives a therapeutic trial of 5 milligrams of hydrocortisone 3 to 4 times a day. And then within 2 weeks, and if the patient comes back, I feel very good. That means he has mild adrenal insufficiency. All right, so he needs that. In fact, I've got so many of these kind of patients. Sometimes even the cortisol can be, see, normal is supposed to be above 50. But it can be even 100, but it's still having, because the person is highly stressed person. So when you're stressed, your resting cortisol is normally high. So when you say it's just on the low side of normal, it's still low actually, all right? Now, secondly, when you on these pills actually, sometimes the symptoms of, you feel tired suddenly in the evening. Why? Because when you excess stress, then you know that you need more cortisol. Just stay a little bit more, that's all.
Thank you, Dato'. Okay, we'll take the last question, and any more questions, I'll be walking around during the coffee hours.
Okay, thank you. I will ask about dysbiosis, about your personal experience.
Sorry?
Dysbiosis.
Okay.
So people with bloating, leaky gut, and so on. And normally they come already using PPI.
Okay.
Sort of, maybe 1 or 2 combination. And then, of course, we try to do the dietary, and then we put her under probiotics.
Mm-hmm.
How is it to make? I mean, are we confident enough to stop directly the medication? Or how are you going to do that?
Actually, PPIs should be reserved for very severe cases like Zollinger-Ellison syndrome. Yeah, those who have an active peptic ulcer, you heard about it yesterday. You are going to increase the risk of B12 deficiency leading to high homocysteine and heart disease. You are going to decrease the zinc, and that's going to give rise to poor immunity and infections. So there's a lot of problems. So acute short-term use, maybe 1 to 3 weeks, is probably fine. In these cases, anyway, these cases are not common. So most of the patients who have gut dysbiosis, the way I treat is I give probiotics, but I always have a very good success rate by combining with nystatin. Nystatin, it's an antifungal oral form, almost has no side effects because it doesn't get absorbed. It is quite safe even in children. I use the two, but the treatment for Candida, you have to follow certain rules. One is to kill the fungus, that is with nystatin. Of course, you rehabilitate the gut with probiotics, okay? One is to kill. The other is to starve. Starve the fungus. That means you have to remove sugar and gluten, if possible, all carbs, because that's what feeds fungus. And I also tell them to temporarily avoid fermented foods, temporarily, because sometimes they don't do very well. So when they do this and take probiotics and nystatin, most of them will feel much better or completely cured. Nystatin can be taken for 5 days, the shortest one. But someone who has psoriasis, someone who has autoimmune disease, they'll have to take for maybe 1 to 2 months. Eczemas may be a bit longer, depending on the symptoms. But I use for a minimum of 3 to 5 days. No, it has to be 4 times, because you have to keep killing the fungus. Fungus is a deep-rooted pathogen, unlike bacteria and viruses. It is rooted, so you'll have to keep killing. So you have to use 4 times a day.